There's a condition named autism, a mental disorder that makes it hard for an individual to focus on one thing. They may have difficulty communicating, interacting with others, and understanding others' thinking or feeling. It can be mild or severe and can range from mild social and communication difficulties to repetitive behaviors, obsessive interests to serious academic and behavioral problems. Autism spectrum disorder impacts the nervous system. It affects a wide range of ability levels and severity, from middle-class families to the wealthiest.
Children with autism have significant problems with social interaction, verbal and nonverbal communication, and have intense interests and repetitive behaviors. They usually do not respond to their names or other people calling them. It is estimated that 1 in 88 children born today will be diagnosed with ASD by age 8. The National Alliance for Autism Research states that it is an official diagnosis of a person with a constellation of behaviors and symptoms and not a single case. ASD symptoms include difficulty with social interaction, disability to make the right decision, repetitive behaviors or interests, developmental delay, and language-related abnormalities. Symptoms of ASD usually appear before the age of 3 and sometimes as early as 12 months. However, there is no definitive cause for autistic behavior. The reason for autism is linked with a mix of genetic causes and environmental factors. It is found that a combination of several factors affects a child's risk for autism spectrum disorder. Genetic factors such as family history, mutations, and chromosome abnormalities can be passed on to children with autism disorder. Studies have shown that the greater the history of inherited autism, the more severe the child's symptoms are. It has also been found that many mental disorders can occur simultaneously in a person with ASD due to not fully understanding their emotions, behaviors, and thoughts.
It is common for people with an autism spectrum disorder to avoid eye contact and make repetitive movements. Also, they may repeat or fixate on certain objects. Children with autism often have difficulty adapting to new situations and people and will have repetitive behaviors and interests. The symptoms must be present for a long time and cause distress or interfere with the child's daily life. Doctors will determine if they are autistic by observing the child's behavior over some time and talking to their parents. They may conduct neurological tests to rule out other developmental disorders or disorders with similar symptoms. The causes of ASD are not well understood at this time but are generally divided into genetics, environment, and brain factors. The goal of behavioral intervention is to help children understand how to react appropriately in social settings and improve their social, cognitive, and language skills. In conclusion, most research studies on ASD claim that helping individuals with autism to focus on an activity will help them decrease repetitive and self-stimulatory behaviors. Focusing on activities can reduce the need for repetitive and self-stimulatory behaviors. Therapy will also help the individual become more aware of their emotions and surroundings.